Hello, everybody, and welcome to my fifth interview of e-patients in Europe. Today, I'm speaking to Birgit Bauer, a leading blogger on multiple sclerosis in Germany. Birgit actually has a blog for Brigitte Woman, which is a leading women's magazine, and where she writes about living with multiple sclerosis in Germany, as well as she's very active in a disability patient organization and writes a lot for them, as well as just a freelance journalist. So, welcome, Birgit. Thank you so much for joining us today, and thank you so much for doing this interview in English. I know it's not your language of choice, and it's a challenge for you. So we really appreciate your effort. Birgit, you told me about your experience of becoming or not becoming a patient in a clinical trial in Germany. You had the choice of going of participating in a clinical trial for an oral multiple sclerosis drug, and you decided against it. How did that come about, and why did you decide this?
As I said yes to the trial, the informations about the first oral pill against MS sounded very great. They all said to me, yeah, you could have a flu, but not more. I thought about it and said, yes, okay, this is a risk which I can take. As a freelancing journalist, I was on research the weeks before I started with the trial, and I asked my network about the first pill and the additional diseases and how it works. And the answers that I got are not very nice. So the other patients from phase 2 talked about skin cancer and other sorts of cancer, problems with heart attacks, or problems with blood pressure and organic problems. And it sounds not so great, and I was afraid. 2 days before starting the trial, I was in doubt at this time. They gave me the contract that I have to sign if I make it. I read this contract. It's 18 sides and a lot of information and medical phrases that you not understand so good. And I read it, and I was more in fear as before. The doubts are growing. And it sounds not good for me, and I thought a very long time. I take time for make a decision, but I saw that the risk for my health is getting higher and higher, and I no, this is not my wish. In German we say, don't trade pest for cholera. So I don't want to trade MS for some cancer or problems with my heart and such things. So I decided against the trial, and this is the main reason. Other reasons were not good information before starting the trial. I asked very often, but they are giving me very unclearly informations. They are not so exactly. And the third reason were the costs. They, for example, they want that women take the anti-baby pill. I understand that. But you have to pay it by yourself. They don't pay it. And so such other costs, additional costs, that you have to take, that you have to pay. Sorry, and this was a reason that I don't understand. I think if they take the health from a patient the patient should not have additional costs. This is unfair. So that was my 3 reasons in a short way.
So what I'm hearing is a lack of information around the clinical trial, the side effects and the possible risks for your health, but also a sort of unawareness of the burden of participating in that trial from you or the patient side. Tell us more about this burden and maybe what pharma could have done to make it more feasible for you to participate in this very important trial for them, obviously.
Okay, what can they do to make it better? At first, they have to pay all costs. And I think it's important for all patients to have no additional costs. So they have to pay for driving costs, for gas or park tickets. They have to pay for additional pills or medications. At second, medical personnel have to give you all information before starting the trial and before the patients are getting the contract. So in the contract are a lot of phrases which are very heavy to understand because they are very medical. Not all patients are very informed in medical phrases. And I think it's important to make this contract very simple, very exactly and very clear and very good for understanding. And third is the neurologists which are making this trials are have to give the patients all information before a long time before starting the trial, then they can make a good decision. So in my course it was very short and it was very unclear till to the last minutes. And I think not every patient is like a freelancing journalist as that he's going into the internet and make a research and ask the network. Not all patients have a good network, so they have to make clear all information a long time before for making good decisions.
And of course, my final question, Birgit, to you is what pharma should do to engage with social media online in Germany on multiple sclerosis. If you could tell us 3 things that pharma could do today to get more and better and more transparent information to multiple sclerosis and patients in Germany, what would they be?
3 things, okay. I think pharmas have to communicate clear and simple so that they can be sure that everybody understands the information. They have to communicate value neutral and without commercials, and I think they have to communicate more with the patients, and they don't have to do so much lobby work in the governments and more work on the patients. I think that's all. Bye bye.